Yeah, hi Vinas, this is Dr. Srikanth from team Mdsconquer. So as we are approaching towards the examination, there is a short, quick revision video on some of the important contents of Inicet as well as Neet MDS. So let's start. So in this particular session, I'll be talking one about the angles in different types of teeth that are used in the complete denture, okay, and followed by I'll be talking about C factor. I'll be talking about Cemento-blastoma. I'll be talking about the ligaments of liver. I'll be talking about the cutaneous nerve supply of leg, followed by I'll be talking about the cartilages and the diagram based content over different types of cartilages. I'll be talking about the trigeminal nerve, and I'll be talking about few histology slides. Okay, so let's start. First and foremost important thing, okay, so I'll be mainly concerned, my main concern is about the questions which are frequently, or the topics which are frequently asked, or the topics which are covered in the last 2 to 3 years of both Inicet as well as Neet. So coming to the angles of teeth, different types of teeth that are used in complete denture. One is anatomical teeth, which you are familiar with. It's anatomical teeth, the angle is 33 degrees. And semi-anatomical teeth, the angle is 20 degrees. And non-anatomical teeth, the angle is 0 degrees. But if you want, you can make a note about the Silverman's closest speaking space. So normal value is 1 to 2 millimeters. Whereas in the case of class 2, it's going to be more, that is 3 to 6 millimeters. Whereas in the case of class 3, it will be less, that is 0.5 to 1 millimeter. So to make a note, topics were repeated in the last few years of the Neet examination. So then comes the second topic, that is C factor. I'm just going to give a brief glance because the well-defined content were already covered in your regular smart videos, which are available on your respective folders on your website. Coming to the C factor, first formula is bonded by unbonded, bonded surfaces by unbonded surfaces, and C factor is related to polymerization shrinkage, which is one of the most problem associated with composites. And we have already discussed how to reduce C factor. There are different methods of reducing C factor. One is incremental layering technique. Second one is you have a different types of new advanced composites that those are coming under smart materials, which helps in reducing the polymerization shrinkage. And you have curing methods, different curing lights, which helps in reducing the polymerization shrinkage. Okay, so we have discussed all this, and you have many questions on this, how to reduce the polymerization shrinkage. And the most common complaint due to polymerization shrinkage, the post-operative complaint, is dentinal hypersensitivity with the composite restorations. So coming to the C factor will be same for class 1 as well as class 5. That is going to be 5 bonded surfaces by one unbonded surface. Whereas class 2, it's going to be 4 by 2. Class 3, it is going to be 3 by 3. And class 4, it is going to be 2 by 4. Okay, right. So you can stick on to these values. So there are a few books telling MVD. MVD is going to be right, 3 by 3. It's going to be 1. Okay, MVD is going to be 1. And of course, once the question was asked about the C factor of root canal filling material. So C factor of a root canal filling material doesn't have any unbonded. So C factor of root filling material is going to be more than 1000. So a few textbooks mentioning it's more than 2000. Means among all the values of C factors, what we have learned, the highest is going to be for root filling material, which is going to be more than 100 or more than 1000 according to many reference books. Okay, so this is all about C factor. So now we'll be talking about the Next important topic. So this question was given in the recent INICET. So we need to have a quick glance over these questions, right? So this is cemento-blastoma. Okay, so cemento-blastoma. Cemento-blastoma, other name of cemento-blastoma is also called as true cementoma. Okay, true cementoma. It is also called as true cementoma. And you can see a cementum like material, like hypersensitivity, hypersensitive cementum. Also you will see it, a similar type of radiographic features, but it is not well defined. It is more of an irregular. And these cementoblastomas are most common in the mandible when compared with the maxilla, and it's going to be around 3 times more in the mandible. And the most common area that is affected, of course it is given in the diagram. So the most common area affected is going to be the mandibular first molar area. So the mandibular first molar area is going to get affected, and it is most commonly associated with a vital pulp. Okay, it's most commonly associated with, and it's a slow growing tumor, and radiographically you can see an attached mass, radio opaque, well defined attached mass present around the root. Okay, and you can see a thin surrounding uniform radiolucent line. Okay, so you can see a radiolucent line surrounding the radio opaque mass with a radiolucent line around it. Okay, so these are the important things that you have to make a note about this particular cemento-blastoma or true cementum. Okay, so the radiographic based diagram based question was given in the previous INICET. So you have to make a note about these few important points. Cementomas, true cemento-blastoma, most common in the case of mandible, most common in the mandibular first molar area, always associated with a vital pulp, radio opaque mass surrounded by a thin layer of radiolucent line. Okay, right. So next one, this is a question that is given in the one of the INICET. So you need to make a note about, so they have asked you to identify this. Okay, so they have given A, B and C, D. So please make a note about B and D. So one is dorsal mesentery, and second one is ventral mesentery. Okay, so the question given in INICET is they have asked which of the following structure is derivative, or which of the following ligament is derived from the ventral mesentery. The main important ligament that is derived from the ventral mesentery is falciform ligament. Okay, falciform ligament. So falciform ligament is basically a ligament of liver. Okay, so again this question was repeated. A similar type of ligament based question was given in ligaments of liver were given in the case of your Neet examination too. So just to make a note, so when I'm talking about the ligaments of the liver, okay, so the ligaments of the liver are, one is falciparum, which is derived from the ventral mesentery. Okay, the second one is left triangular ligament, right triangular ligament, coronary ligament. Okay, so falciform, left and right, and coronary ligament. All these 4 ligaments are derived from the ventral mesentery, except the round ligament. Okay, except the round ligament, all the ligaments are derived from the ventral mesentery. So I don't want to go very deep into this, because this is less often related to embryology, which we are mainly concerned about. Embryology of head and neck, followed by thyroid, tongue, a few other areas are important, but embryology of liver and all these are not so important. But anyway, it is given. So as it repeats, we need to have a glance over this, and this is more than sufficient. So make sure how to identify the ventral mesentery, and make sure the ligament names of the ligaments which are derived from the ventral mesentery are very, very important as of now. Okay, right. So I'm jumping to the next important content. So that is your cutaneous nerve supply. So jumping into cutaneous nerve supply, the main concern from a general surgery point of view is we are well familiar with the varicose veins. Okay, so varicose veins are which we are well familiar, and you have many aspects related to the varicose veins, and the surgery is related to the varicose veins. So whenever we are going for the varicose vein surgery, there is a high chance that we can damage cephalus. Okay, we can damage cephalus nerve. Okay, the cephalus nerve is basically the longest and the largest cutaneous branch of femoral nerve. Okay, so this is the branch of largest and longest cutaneous branch of the femoral nerve. So there is a high chance that we are going to damage this. Okay, we are going to damage this. That is L3, L4 of cephalus. Okay, so what happens whenever you're going to damage this? So the clinical scenario that they are going to give is sensory loss over the medial aspect of leg and foot. So after varicose vein surgery, if they are giving a clinical scenario of loss of sense on the medial aspect of the leg and the foot, so this is the medial aspect, okay, of the leg and the foot, so your answer is going to be the cephalus now. Okay, so apart from this, I want you to make a note about the sutural nerve also. So whenever there is a damage to this particular nerve, they are going to give an information in the question as a sensory loss on the lateral aspect of the distal 1/3 of the leg and the lateral side of the foot and the fifth toe. Okay, so this is the lateral aspect of the foot. Okay, so whenever they're giving lateral aspect or distal 1/3, so this is distal 1/3. Okay, so whenever they are giving loss of sensory supply over the posterior and the lateral aspect of the distal 1/3 of the foot, this is distal 1/3 of the foot, or whenever they are giving, okay, lateral side of the foot and the fifth toe, so lateral side of the foot and the fifth toe. Okay, so in this descriptive part you have to go for sutural nerve as an answer. Okay, so you should be familiar with these two statements and the descriptive part where the sensory loss will be there. Okay, so this is all that you need to make a note about this application based question over your general surgery topic. Whenever the paper setters want to give a question, they will be more focused on aspects of head and neck followed by the brain, maximum ear and eyes they may focus. Okay, anatomy of thyroid is also important. Okay, this is the limitation they have. Okay, so whenever they want to come for lower limb, they may correlate to a clinical scenario which is very, very important. So varicose veins treatment plans and everything are very important. So indirectly they can ask a connected based integrated based question, so which you should be familiar with these things what I have discussed now. So next comes they can ask you identify this particular nerve, and you can see three beautiful branches. So whenever you see three beautiful branches, your answer is trigeminal nerve. Okay, right. So your answer is trigeminal nerve, and you're familiar with most of these things of trigeminal nerve. So I don't want to discuss much about trigeminal nerve, but trigeminal nerve is basically, it contains V1, V2 and V3. V1 is ophthalmic, V2 is maxillary, V3 is mandibular. So I want you to open your smart notes available on the website and check out the cranial nerves notes, written notes, which is very, very important, right? So maybe they may focus on few of the clinical scenarios if they ask a case-based question. So they can tell about photophobia or the skin of your forehead, scalp, eyelids, nose, your mucous membrane of the paranasal sinuses, nasal cavity, and everything are supplied by ophthalmic. And coming to the maxillary, which you are very familiar, okay, so it comes out as from the foramen rotundum, and it's going to supply nerve supply to that of upper jaw and the skin of the face over the maxilla, mucous membrane of the nose, maxillary sinus and palate. And the next comes is the mandible. Mandible is basically associated with the skin of the cheek, mandible, side of the head, and of course there will be lots of motor supply which supplies to the muscles of mastication, anterior belly of digastric, mylohyoid, tensor tympani. So I hope you are very familiar with all these things, and do make a note foramens, from which foramen things are going to come. Foramen rotundum, mandibular branch comes out from foramen ovale, Okay, right. So you're familiar with all these things. Okay, just have a glance over the trigeminal now, and they can ask you to identify the foramens. Foramen based diagram based question can be given, as well as the nerve based nerve based. So for example, identify this yellow color cranial nerve. The answer is going to be your trigeminal nerve. So next comes is this question was given for the medical INICET. Okay, so they have pointed and asked to identify the pancreatic islets. Okay, islets of Langerhans, the pancreatic islets of Langerhans. So I don't want to go much. They can ask you the excretory duct, and similar pattern of question can be asked in the histology of your salivary glands also. So I just want to give a very important landmarks that you need to make a note. So regularly these islets are the secretory cells which are surrounded by the reticular fibers. Okay, so and of course you are well familiar with these fibers. These reticular fibers are made up of type 3 collagens. So types of collagens are very important, and examples and everything, right? So these are the reticular fibers, and these islets are surrounded by a delicate capsule. Okay, so make a note, these islets are surrounded by a delicate capsule, and of course you can identify this exocrine duct which is available. And coming to the pancreas, the other important area we need to focus about the different types of cells. So alpha cell or A cell, right? So which you are familiar. These are most commonly located on the periphery. Okay, they are located on the periphery, and they secrete what they secrete. They secrete glucagon. Okay, so next comes the most favorite for all of us, beta cells or B cells. So these beta cells or B cells are located in the center. So these are present in the periphery, and these are present in the center. Okay, so what they produce? Yes, perfectly right. They produce the insulin. And next comes is the delta cells. Okay, so delta cells are scattered between the beta cells. Okay, they're present between the beta cells. They're present in and around the beta cells, and they secrete stomatostatin. Next comes the PP cells. These PP cells are basically they're present in the islets, and they're present in the exocrine glands, what we have discussed in the diagram based question, right? And the main purpose is they secrete PP, or nothing but pancreatic polypeptide. Okay, so there are other minor cells which are present here. Okay, there are two types of minor cells. One is D1. These are four are major cells, and two minor cells. One is D1, and second one is enterochromaffin cells. Okay, so these enterochromaffin cells, they are going to secrete serotonin, whereas D1 cells, they are going to secrete VIP, which we have discussed in the physiology, that is vasoactive intestinal peptide, which is basically a hormone that is going to induce hyperglycemia. Okay, right? So these are the important cells and their contents which are going to be released, and they are very important from examination point of view. Okay. So last but not the least is the types of cartilages. Okay, so type of cartilages were already well covered in your smart notes. So I just want you to go back, try to cover the types of cartilages table that is available. Okay, and make sure try to cover all the diagram based questions related to the types of cartilages. Okay, and examples. Okay, hyaline cartilage, where does hyaline, the normal question is type of collagen in the cartilage is type 2, cartilage type 2, we have already discussed. So similarly, you have three types of cartilages that are available. Okay, so I want you to go back and check all the three types of cartilages, their histological features. Histological feature is a very commonly asked question. The question was repeated both in INICET recent one as well as in the Neet recent one. So they're going to give you a simple histological diagram directly from Inderveer Singh, and they're going to give all the three options and identify. It's very simple. Or they can give a histological diagram based question, and they can ask you to identify the example. Where do you find, in which of the following areas or in which of the following places you can find this type of cartilage which is being given in your histological section. Okay, so histology is very important, already covered, so I don't want to discuss in this particular video. Okay, so I'm done for now. I covered 8 important topics And of course, this is a quick revision video, not a depth-oriented video. So depth-oriented videos are already available on the website, and make sure you use it. Okay, so before going into the session, so if you are interested in any of the crash course of Mdsconquer, so these are the 4 crash courses available, and you can ping us at any time, okay, on these numbers. So we are ready to help you out. And in the crash course, we work so hard to provide as many question papers as possible, as many contents as possible, as many quick revision videos as possible. All these are going to increase your scores. Okay, so 25 mock examinations of Neet plus 10 mock examinations of Inicet. So we are going to cover a huge content here, and the main goal is to improve your accuracy and marks and end up with a better rank. Okay, so signing off, Dr. Srikanth from team Mdsconquer, and please do like, share, subscribe our channel. Bye, take care.